Welcome to Healthcare du Jour, where we dish up and digest the latest in healthcare. For the next 30 minutes, sit back as we bring you insight, commentary, and discussion on trending topics to the table, all expertly served up by our host and his guests. Now here's your host, Matt Fisher.
Welcome back, and thank you for joining as we dive into the hottest topics in healthcare. I'm your host, Matt Fisher. On the menu today is Anup Panthaloor, Executive Vice President, Health Plans and Healthcare Services at Firstsource. Anup, welcome to the show.
Thank you, Matt. Thank you for having me.
So what I always like to do before getting into the main part of the discussion is to give my guests a chance to provide more of an introduction in terms of who they are and what they do. So Anup, the floor is yours.
Thanks, Matt. So just a little bit about me. Anup Panthaloor. I live in Connecticut and been in healthcare for close to 22 years. Prior to that, dabbled in banking and financial services and mortgage industry. Actually started off my career in manufacturing world. So by education, I'm a mechanical engineer. Quickly realized that I'm not a good mechanical engineer when I hit the shop floor. So moved to services industry. Developed passion for quality. I picked up Six Sigma during my manufacturing days. So started my Six Sigma process consulting journey and, did some consulting assignment in BFS and then in mortgage industry and did my first consulting assignment in healthcare. Close to 22 years now, 23 years back. And I'd always tell the story because it's fascinating because when I started my journey and did my first consulting assignment for a very large payer, came back home and told my wife, this is the place to be in. Not for the love for healthcare at that time, it was more of job security. And I said, as part of, if I'm a consultant and US healthcare is so messed up, that I'll never lose my job. It hasn't changed much. I think healthcare, we've seen it changes every day. I'm still learning. Been very fortunate, have worked on the payer side, have worked on the provider side, worked with intermediaries like PPM and clearinghouses to understand the overall healthcare continuum real well. But it's ever changing, world in healthcare, and there are new regulations, new things which are happening all the time. And it's always interesting. Now I think I love healthcare, although I didn't start that way, but avid healthcare lover, if you may, and you really want to make an impact and do things which could help us improve the overall healthcare system in US and across the world.
And those are all definitely very true words, that it's an area that people become passionate about once they get into it. And as you said, also always changing and lots of challenges. So kind of with that in mind, what areas do you like to focus on right now?
So I think, one of the key themes, if you look at it, today's topic is also on that. There's a profound shift which is happening in healthcare, right? In the healthcare delivery system itself. What I call it is a change in what episodic care to continuous care model. If you look at traditionally, episodic care is after the fact, after the event. I get sick, I go to a doctor, I see the doctor, get the medication. It's moving to a continuous care model. And with the technology disruption, it is becoming more and more important to continuously monitor, the physiological data, the social determinants of health, the lifestyle factors to really make an impact on cost of care. And there's also an interesting data point if you look at the overall spend in US. And this is applicable globally. Right? If you look at disease types and you look at what's causing those disease, it's a fact that 70% of the diseases are caused by lifestyle factors and behavioral health, right? Only 30% is genetic. And I think the focus has to be that how do you start impacting behavioral health changes and how do you start impacting lifestyle factors, right, which will bend the cost of care curve.
And as you said, lifestyle and mental health play such an important role. But what are some of the ways that you've seen to start collecting that information? Because I feel like historically that information has kind of been hidden from the healthcare system, or just not collected because as you said, when you're focused more on the episodic care, you're only arguably worried about the immediate issue in front of you.
Yeah, so it's an interesting aspect, right? So if you look at it, how CMS has also been driving some of it, right? So there is, they call it physiological data or empirical data, which is based on what you're measuring, right? Your blood pressure, your glucose levels, your weight, and so on and so forth, which you're measuring. And it was always done in office when you meet your provider. Now there's, since 2019, how CMS has introduced those 5 procedure codes, CPT codes, and now they're pushing remote patient monitoring and how you use devices to collect that data on a regular basis. That's the empirical side, which only tells you about your current condition, right? Your current medical condition, what's your blood pressure level, what's your glucose, continuous glucose monitoring devices are there to monitor your, blood sugar levels and so on and so forth. But the factor on lifestyle, right, and behavioral health changes, which is what's happening with your mental health, what's your current situation, which will basically help them assess the future health risk scores, right? What's changing in your environment? Now, specifically in Medicaid, now there's a whole concept of social determinants of health, right? Which is how's your environment? What environment do you live in? What are your barriers to access to care, and so on and so forth? Similarly, from a behavioral health perspective, how's your lifestyle changing? Are you doing things differently? That's an important aspect right now. Health risk assessments is something which is CMS has defined it for Medicare population as part of the annual wellness visits, which has to be done. And in Medicaid, after the enrollment, just after 90 days, you send those health risk assessments. But that is also a point in time, right? So you're doing that health risk assessments, questionnaires. It's hyper-personalized, and you're trying to gather as much information you can, and then doing the risk stratification and taking interventions as much as possible to make an impact, right? So health risk assessments are going to be key components, but it has to work in parallel with empirical data or physiological data of individuals.
And yeah, so kind of that health risk assessment sounds like a very important concept. So can you just help explain in a little bit more detail, what it is and kind of the specific information that it might be collecting? Understanding, as you said, there's like at least a couple versions of it with Medicare, Medicaid, and is it safe to also say commercial insurance might be adopting it as well?
Correct. So definition is, as it says, health risk assessment is an assessment and appraisal, which is basically sending a questionnaire to the individuals, right? Asking them questions on lifestyle factors and questions on specific health conditions. So you're assessing a risk of an individual, right? And it's based on their current status and what's the future health risk score for an individual. Now, as you rightly said, Matt, this is Medicare and Medicaid has specific mandates by CMS. Employer groups or commercial plans are also understanding the importance of health risk assessments and how they can digitally engage the population to make an impact on behavioral health or lifestyle changes is becoming more and more important.
So, and as you said, it's a collection of information at a moment in time. And I think if I heard you correctly, you also said at least for Medicare, it's part of the annual wellness visit. So does that mean that it's updated on an annualized basis at a minimum?
That is correct. It's updated on an annualized basis at a minimum, but more and more industry is moving towards, and this is my bold prediction, but it's about how do you continuously engage with the population and look at what are the changes happening, because all of us go through different changes in our lifetime. There are events which happen. How do you keep your member population engaged and collect that information in a near real-time basis, right? That's something which needs to happen, right? As you are doing the whole RPM segment, right? The whole physiological data. Now you can have devices, and there's a whole disruption which is happening there in terms of collecting physiological data through devices, right? Through your smartwatches and chips and so on and so forth, which is going through a significant change and disruption. Similarly, you need to have something on assessments as well, right? On a regular basis so that you can collect information and then map these both so that you can take interventions. Because based on health risk assessments outcomes, you can now create personalized risk scores for individuals, and then plan for interventions which you need to make, right? So how do you enroll them on to certain wellness programs which you can design for specific individuals? And we all know one size doesn't fit all in healthcare context, right? It has to be hyper personalized. It has to be in their context, right? And that's very, very important.
Yeah, and kind of as you're saying, that digital collection makes a big impact. So, what are some of the strategies that are being taken to digitize the process?
Yeah, so health risk assessments has been there for quite some time, right? And I'll map it back to why it is important to collect it in near real time as the events happen. Traditional way of doing health risk assessments is either making outbound calls or telling the members or giving the members an option to go into the portal and fill out these health assessment forms. And the third aspect is sending paper health risk assessment forms, right? By Press and Ganey and so on and so forth. You're sending physical paper to individuals. And now it's part of the compliance from CMS. So as part of annual wellness visits or from a Medicaid perspective after 90 days, you're making the call, you're asking members to go onto the portal, and then you're sending paper forms. The completion rates are very low, right? It's in the tune of, the best in class would be in the tune of 18 to 20, 23%. You're still not capturing the population, right? And there's a significant gap. And hence, the need for digital engagement becomes important, right? And the barriers, right? If you think of it from a persona perspective and think of it perspective of how difficult it is. These are 30, 40 questions, right? So first, how do you create hyper-personalization based on what you know about the member and not ask questions which are known? Second, send HRAs in the preferred language of the member. Like if you're sending somebody English, it can't be English for everyone. You need to send somebody Spanish forms or Cantonese or Mandarin based on what language they would want to, respond to. And there are aspects of designing HRA forms also in terms of, for Medicaid population, you're probably writing English which is easy to understand and not complex sentences and so on and so forth, because you need to capture the accurate information, right? So the whole design aspect is very important. And you're sending them, making phone calls, it becomes an issue. I'm picking up a specific example because it's proven that in Medicaid, and this is based on recent experience as well, 60% of the phone data is not valid, not accurate, right? So you're then going into typical outbound calling where are you doing the right party contact? Is a connect rate happening? Once you get the right party contact, then you're trying to get the information, but the data is not accurate. So it becomes, your completion percentage is low. Second aspect, you're asking members to go on to the portal and fill it out. People don't do it because they don't know whether it's important for them or not, right? And then sending paper. You're sending paper home. I mean, I get a lot of mails as well. I don't know, half of the mails, I don't even open it up because I don't know whether it's important or not, right? Digitally engaging them. So the way we're working through this is how do you create digital engagement? Now, leveraging microsite technology, right? So you send them text. First of all, you get the information of the member, and the member try to enrich that information by bouncing it off with available public sources. And there are specialized services to get to the accurate phone number information and demographics information and so on and so forth. So how do you enrich that data? Once you enrich the data, digitally engaging them, so sending them a text message with a very hyper-personalized text in it saying why it is important. When they click on that link, it opens up HRA form, and you can embed a short video about why taking a health risk assessment is important for an individual, right? Explaining to them why is it important and why should they do it. And then for them to take that assessment on a phone or on a tablet, which is easy to do, right, with a click of button kind of a thing, and can be completed within 10 to 15 minutes. And collecting that information. that digital engagement, we believe is going to, disrupt the way you've been doing traditional HRA and is going to help improve the completion percentage. Now, there has been there could be a question from you. There has been questions from the folks about Medicare population, would they engage digitally and so on and so forth. And there was a study which we did, and we realized that 75 to 80% of Medicare population uses smartphones and tablets and so on and so forth, right? So it's easier for them to get engaged and send these assessments and so on and so forth.
Yeah, and actually, I think you anticipate a valid question, but I've seen in my personal experience just with technology companies that, as you said, those senior populations that are Medicare are very tech savvy at this point in time. And you kind of have to remove those old assumptions that you're not going to get that engagement. And for those of you just joining, I'm talking with Anup Panthaloor from Firstsource. We're talking about health risk assessments and a digital approach to it. So it's, I guess, as you've seen some of that transition to the digitization, have you seen the completion rates start to improve, or do you have kind of other indications? Because, I think the figure you gave before of, what was it, like 18 to 20% completion is pretty poor, because that's, as you said, a very small percentage of your patient population.
Yeah, we've starting to see jump in that completion percentage from 18 to 20% to now close to 40%. And we're hoping with enrichment of data and the way we are approaching and creating hyper-personalization, and I talked about embedding videos, which talks about the importance of doing health risk assessments and so on and so forth, is going to help us improve it to close to 60%, right? That's the goal. We're probably trending around 40%. We want to move it up to 60%. And this is still phase one in my mind, right? And the phase one where you're changing the way traditional HRAs has been sent into more digital engagement. Phase two is going to be continuous engagement, right? So giving an option for individuals to report any events which have happened and sending them short surveys, the concept of patient-reported outcomes, right? So as soon as something happens, a life event happens, how do you send them a short survey and they respond to it? So continuously engaging them on a digital channel, because sending paper forms is not feasible from a cost structure perspective. Sending a lot of paper, making outbound calls, it's not feasible from a cost administration perspective. So how do you digitally engage on a continuous basis? That'll be phase two, right? And then making it easier for individuals, right? So not just making it interact question answer based scenario, but giving them more scenarios and helping trying to capture the future risks associated with individuals' lifestyle.
Yeah, and I think, as you were saying, capturing that real-time data, other than the fact that the paper, it seems to have been proven not to be effective, if you continue to go that route, by the time you'd send it, now you're probably already a couple of weeks past the event. And if you get a response back, now you're looking probably at a month or more, and it's then how relevant is that data? So what are some of the challenges, though, that you anticipate in moving to that phase two of knowing when that trigger occurs?
I think it is about how do you continuously engage and create insights, right, from the empirical data which you receive. So from a health plan perspective, there's a member 360-degree view, right, which is based on your claims data, based on your pharmacy data. You receive a lot of information about the member, and if there is an event which is happening, which has resulted in a claim or some kind of opportunity, you send out a proactive trigger to the member, asking what happened and so on and so forth, and designing very hyper-personalized HRA. So today also HRAs are based on evidence-based. There are your lifestyle questions, there are clinical questions, and so on and so forth. But how do you create hyper-personalization based on individual's journey, right? Healthcare journey, if you may. And that has to be based on analytics and data mining, based on claims data, as I said, pharmacy data, and so on and so forth.
And kind of as you start continuing in that direction, what do you think are some of those building blocks that will need to be either developed or put into place to enable that hyper-personalization? Because, as you're describing it, it definitely makes sense of, instead of sticking everyone into the same form, let's actually learn and adapt to each individual as they're going through their life, because no two people are going to be alike.
Yeah. So there are three aspects of it, if I may, right? HRA intake, right? Which the first phase is we are digitizing HRA intake. Today, it's very manual. It's phone calls, paper, portal. We are bringing in digital engagement channel. Right now, phone calls, paper, fax, or portals, there is an intake process, and then you're creating risk scores and defining care interventions. The first phase is creating digital engagement there. Second phase would be based on data which is available from HRA intake, as well as claims data, pharmacy data, and so on and so forth. How do you marry this data and create more of a proactive, mechanism, or an e-cockpit mechanism, right, where you understand individuals' health journey and create trigger points for sending out these questionnaires at point in time when the event happens, right? So there is a whole analytics engine and insights engine, if you may, will have to be created. And now with the advent of AI and so on and so forth, you can develop that model, right? So data and analytics and insights, how do you create that engine so that you can trigger? And then the third aspect would be, once the trigger aspects are designed, how do you create hyper-personalization based on data which is already available? So last thing you want is, for example, I'm a diabetic patient. Don't send me a questionnaire asking whether I'm a diabetic patient or not. You already know that I'm a diabetic patient, so don't ask me a question which you already know about me, right? So how do you create hyper-personalization? If you know something about me, don't ask me that question, right? So create shorter surveys, right, to gather as much as information as you can. And that's a third aspect. And within that third aspect, a bullet point, sub-bullet point on that would be devise mechanisms to keep them engaged, right? So for example, sending out, not just always asking questions, but about interventions which you're making, right? Send them videos about, okay, a 30-minute walk every day is going to be helpful, right? How do you, if they complete that task, create a reward and recognition mechanism, create a hyper-personalized individual health scores. Now, this is another thing, Matt, I believe hasn't happened yet, but will happen in future is, and I'll draw an analogy to banking and financial services, right? We have our credit scores, and that came in to impact behaviors on how do we financially manage our credit scores and so on and so forth, because it has an impact of whether I can buy a house, take a car loan, and so on and so forth. We don't have a score for healthcare, right? Individual score. If today I ask you, or what's my health score, I don't know, right? But with this, in future, you should be able to create a health score for individuals, right? And create a reward mechanism associated with that health score. And the continuous engagement will come in when they are supposed to, you enroll them for a wellness program. If they are a tobacco user, enroll them into a smoking cessation program. And if they're making improvements, show them the improvement in score, right? If they're in diabetes or hypertension management, you have a wellness program designed for that. And if they're making interventions, how do you show them that they're improving? So it's more of a gamification to engage them. And then this whole HRA aspect, or getting that information, the questionnaires has to be specifically tailored for individuals based on that. If that makes sense, Matt.
Yeah, no, it definitely does. And as you're saying, there's so many different factors that go along into or go with it, and then come together to help drive better interactions. I guess the question is, who do you think is going to be, or kind of take the lead in helping to develop and implement? Is it going to be the payers? Is it going to be the providers? Or, I guess, as I'm going to say it out loud, I feel like it should be a collaborative effort, because it impacts everybody.
It does impact everybody, right? And it's not payers or providers. It has to be a collaborative effort, and it is more of education, right? Payers have to collaborate with providers, and as you see, value-based reimbursement programs are coming into place. So how do you make this as an integral part to motivate providers to push that to the members, right? At the end of the day, I trust my provider more than my health plan, right? So the education piece has to come from the provider's piece. So it has to be a collaborative effort.
Yeah, and kind of I think as you're saying, it's like I suspect your statement applies to many individuals where you trust your provider more, but maybe the payer has greater resources to be driving the continual interactions. So it's kind of, and I think you said kind of feeds into that value loop of neither side can do it alone. It all has to be kind of removing old animosities and getting onto the same page.
Yeah, and payers, if you look at it, have to continuously look at options to improve quality of care, right? That's a value proposition. Otherwise, this is another statement which I would make, which is becoming prominent, and there are questions being asked. Payers are collecting premiums and distributing premiums, right? So they become a financial intermediary. The real purpose of payers is to how do you provide quality of care to the members of the health plans? So this is the value which they are bringing in, right? So how do they collaborate with providers to make interventions, right? So that you can create a better quality healthcare ecosystem and provide better healthcare for the members.
Yeah, no, it definitely makes sense. And Anup, believe it or not, we're already almost at the end of our time. So kind of your last statement kind of, I think, brings around to a nice closing question, which is, in the rest of the year, kind of what do you predict will be the biggest movement on that individual engagement as we continue down the road that you've been describing?
I think there's been a lot of effort being done in terms of hyper-personalization. The biggest movement is going to be about how do you create hyper-personalized personal health risk scores for individuals, which can be associated with incentives and rewards program, which will really impact the lifestyle and behavioral health changes. And as I said, 70% of the diseases are caused by lifestyle issues and behavioral issues. If you can start impacting that, that will bend the cost of care curve.
Yeah, I think certainly something to track. And as I said, believe it or not, we are already out of time. I want to thank my guest, Anup Panthaloor, for a great conversation today.
Thank you, Matt. It was a pleasure. Thank you very much.
And thank you to everyone listening. Keep the dialogue going and connect with me on #HCDEJURE. I'm Matt Fisher. Until next time.